Good evening, everyone. We just want to wait another minute or so just to let people continue to join in. So if we could just hang on for a second, we will get started shortly.
Yeah, you got pretty good. Is Justin not coming out for?
All right. So thank you all for joining us this evening for the virtual information session. My name is Christian. I do oversee the nursing program at our Worcester campus, as well as our Manchester, New Hampshire campus. So tonight with me, I have my colleague, Christine, and Christine oversees nursing at our Boston campus. Christine, if you'd like to say hi, feel free.
Hi, everyone. Thanks for joining us tonight. It's so nice to see you all.
All right, and so we also do have an instructor with us tonight that will be speaking a little bit to you and an opportunity for you to ask questions as well. So we do ask, so we'll go through a presentation. We do ask that you are interactive and I'm sure you will have questions. So please feel free to type your questions in the chat box and we will be sure to address them at the end. So if anything comes to mind, yeah, feel free to jot it down and we're happy to answer any and all questions. All right, so we will get started.
All right, everyone. So first off, congratulations on your decision to pursue a career in healthcare. Healthcare is a really great field to get involved in right now, as well as it has been for many years. But the field is in high demand. So what's really great is that there's an aging population and the projection of the career of nursing is going to increase in the next several years. So as you can see here in the Bureau of Labor Statistics, um, healthcare is going to be about 1/3 of all new jobs created through 2026. With that being said, our students here at MCPHS are finding job placements very soon after graduation, within 6 months to a year, and they're sometimes receiving job offers before they graduate. So not only does the field of nursing have a very strong projected job outlook, it also ranks upon the top 30 jobs in healthcare careers, according to the US News and World Reports. We realize that returning to school is an investment in both time and money. So what's really great is having the current job outlook and the quality of education that you receive here. We believe that it is a great investment for your resources. There's so many things to look forward to. Before we move on, I'd like to turn it over to our faculty to share a little bit more about the career possibilities in the field of nursing.
Hey everyone, I am Professor Edie Hamilton. I teach on the Manchester and Worcester campus, specifically maternity, pediatrics, and the capstone course. I think one of the greatest things about nursing is you're really able to have so many avenues. This week actually was our first week of our summer semester, and I often ask students what type of nurse they want to be. And most of the time it's in the hospital setting, but there are so many different settings. One wanted to be a correctional officer and be a nurse in, a prison setting. There's lots of different clinical settings that you can be in. Of course, teaching is where I am currently. So there's so many job opportunities and different avenues. It doesn't always have to be the classic in hospital that we think of. There's lots of other jobs that nurses can do. There's legal nursing, if that's something you're interested in, forensic nursing. So there's lots of different options out there.
Awesome.
Thank you,
Thank you
Edie.
so much. All right. So, not sure if you're all aware, MCPHS is actually a healthcare specific institution. We started as a small pharmacy school over 200 years ago, and we have since been able to expand to over 100 different programs across our campuses. Christian had mentioned that we have our Boston campus, our Worcester, Massachusetts campus, and our Manchester, New Hampshire campus, which brings us over 7,500 students across the US and from over 100 different countries. Healthcare is our specialty, so it's something we really pride ourselves in, of being able to have our students succeed and learn in that hands-on approach. So our students are able to really connect with their faculty members. They're able to learn from our faculty members, many of them who are still working within the healthcare field while they're teaching. Through school-sponsored events and activities, our students are able to learn about many different healthcare professions and learn between each other on those healthcare professions and how you work as a team once you get into the field. And we do pride ourselves on maintaining strong clinical affiliations with some of the leading medical institutions across the nation. We'll touch base on this a little bit more when Christian talks about clinical rotations, but just so you see some big names on the slide there: Brigham Women's Hospital, Mass General, Boston Children's, Elliott Hospital in New Hampshire, St. Vincent's Hospital right across the street from our Worcester campus. So some really strong clinical affiliations that we have. So let's talk about our 3 different campuses. So Boston is our flagship campus, founded in 1823 in the Longwood medical area. It's surrounded by well-known medical facilities. We're on the same street as Boston Children's Hospital, Harvard Medical School, Merck Pharmaceuticals, so it's truly the hub of healthcare. The majority of programs on this campus are undergraduate, but we also have a variety of graduate, doctoral, and certificate programs as well. University-sponsored housing is available for students on the Boston campus. If we go west of Boston to our Worcester, Massachusetts campus, it's about 45 minutes west. And Worcester is actually the second largest city in Massachusetts, and our campus was founded in 2000. Worcester is also one of the fastest growing hubs of innovation in the US. NPR deemed Worcester the new IT city, which is pretty cool. Right outside of our campus, we like to say kind of like a stone's throw away from our front steps is St. Vincent Hospital and UMass Memorial Medical Center. They're all available to our students to learn and grow from as well. And all of the programs on our Worcester campus are either graduate, doctoral, or post-bac programs. University-sponsored housing is also available on our Worcester, Massachusetts campus. And then if you go about an hour north of Boston, you'll hit Manchester, New Hampshire, which is our campus that was founded in 2002. It's the smallest of our campuses, having around 500 students total. Manchester is it's a really great campus if you're looking for that small community, but also the ability to go to, the mountains, to the lakes, to the city if you would like. So it kind of offers everything within that campus. We don't have on-campus housing for our Manchester campus, but there's plenty of off-campus housings in the surrounding area. Really close to some clinical affiliations that we have. I mentioned Elliott Hospital in New Hampshire, Concord Hospital, Dartmouth Medical Center, and so many more. And this campus is also more of our professional campus with post-grad, graduate, and doctoral programs. All right, so I had mentioned learning from each other in terms of the healthcare setting. So what's really great is that we have something called, excuse me, interprofessional education. So we call that IPE. Interprofessional education allows you to learn from students who are studying other healthcare professions. So at least once or twice a semester, our students are connecting with, our nursing students are connecting with our pharmacy students, our PAs, PT, OT, optometry, and are able to really, I always like to say, healthcare is a team sport. So being able to do case studies and learn from each other and how each healthcare profession is going to view a patient in a different aspect and how you can learn from each other once you go out in the field. So what's great about that is being able to have the opportunities to learn from each other, but having that hands-on supportive experiences as well. We do have over 748 faculty members across all our campuses. 91% of our faculty are full-time and hold terminal degrees in their field, which means that they have the highest level of a degree that they can get. And as I mentioned before, a lot of them are still working within the field, which is nice because they can bring back the changing things that are happening within healthcare, bring that back to the classroom and make sure that we're up to date on supporting and teaching our students. We have student success services on top of having on-site counselors for mental health, wellness. We have a center for career development. We also have faculty advisors, academic coaches, peer mentors, peer tutoring, and an NCLEX success coach. So all of this is available to our students, as well as over 100 different clubs and organizations. So you really can get involved on campus no matter what you're interested in. So to talk about the differences that we have with our programs that we offer, so our post-baccalaureate nursing program is a 16-month nursing program across all three campuses. We have the availability to study in Boston, Worcester, or Manchester. This program has 2 different start dates per year, so either the fall or the spring. But we also offer a traditional 32-month program on the Boston campus that we consider our accelerated nursing program. Accelerated in the sense that it's only 32 months long, but people often confuse these two because of the titles. You may see at other institutions. Our post-baccalaureate nursing program may be called the accelerated nursing program at other institutions. So one thing to think about is that the post-baccalaureate nursing program is traditionally for students who are looking to get a second bachelor's degree. So that you have a bachelor's degree in something else and you want to pursue a bachelor's in nursing. We also offer graduate nursing programs that are offered online. We have a family nurse practitioner master's program and a psychiatric mental health nurse practitioner master's program. As I mentioned, they're all offered in a convenient online format. And so just to talk a little bit about what our students have access to during the post-baccalaureate nursing program, our students are able to have a wide array of resources to aid in their learning process and prepare them for a future career as a nurse. Throughout the program, our students have access to the use of educational technology, multiple clinical sites and experiences in a variety of settings, NCLEX preparation throughout the curriculum, and review upon completion of the program before you take that licensure exam, and the use of state-of-the-art facilities and labs on campus and those state-of-the-art clinical rotations. I want our professor to share a little bit more information about this. So some simulation experiences, how there's that exposure and technology that our students can use.
Thanks, Christine. So in each of our campuses, so Boston, Worcester, and Manchester, we have laboratories that we use to help with your skills before you go to clinical, and then throughout the semester to kind of continue learning new skills and kind of honing those same skills. So the types of mannequins that we have, which you can see in what the photo here, that's called a low fidelity mannequin. So these are typically the mannequins that you would take vital signs on. You can listen to their heart, you can do chest compressions, and the other type of mannequin that we have is a high fidelity. So our high fidelity mannequins can communicate with you. So they talk to you, they can cry, they can turn different colors. They have lots of different heart sounds and lung sounds. They have the ability to inject medication into them. So you can poke them with needles. You can give them different IV medications or IM medications into the muscle. So we have lots of different ways to help make it more realistic. And often the professors that are in your laboratory or simulation are the professors that you have in the clinical setting. So you're also getting to know them on another level as well, which is nice because you're spending a lot of time together throughout this semester. We practice giving all medications that you would give in the acute hospital setting. So that includes things like IVs, working with pumps, doing IM injections, giving suppositories. We also do disaster management planning in your final semester, which students always really enjoy. Thinking about fun, Grey's Anatomy scenes and things like that you've seen on TV, I'm sure. So bringing that into more of a real life understanding. And a lot of our students really enjoy simulation because it just takes them out of that clinical setting and really allows them to kind of make mistakes and talk through things in a really safe and supportive environment.
Thank you, Edie. So as a student, you do get a lot of hands-on work in our lab. So it is a mix of class, lab, and out at clinicals. So just so you know, clinicals will be 1 to 2 days a week throughout your time here. And the clinicals are typically in an 8-hour shift. And we have a wide variety of options that will be available to you. So the rotations include med surg, mental health, maternity, community health, and advanced med surg. So we have clinical sites within Mass, Connecticut, and throughout the Northeast. We do say that the clinical rotations would be a maximum of an hour from campus, and you are able to request locations, and we do our best to accommodate that. We can't guarantee because we do have to go by what's available, but again, we do our best to make sure that our students are accommodated and are successful. So to apply, if you are interested after this information session, we do hope to see application from you. The application is actually no longer on the nursing cast. So you can actually apply directly on our website. And we did that to make it easier for the students. The nursing cast did charge a fee. And with our direct web application, there is no longer a fee. So you can apply directly at mcphs.edu. And you would be looking for the transfer application. Since you are post-bac, you are considered a transfer. So you would look for a transfer application and you would get started there directly on our website. With your application, we would need your transcripts from all colleges attended. You can upload them directly on your application, or you can have them sent to our email inbox. If you're an international student with a foreign bachelor's degree, we would have to have that evaluated. And you can get that done by WES, which is World Education Services, WES, or CED. If you are applying for our New Hampshire campus, you would have to submit a high school transcript. That is only applicable to our New Hampshire campus. We do not require any letters of recommendation, but your application will have to include a personal statement. For this, we say about 500 to 1,000 words, just a little bit about you, and why you want to be a nurse, what you feel you can add to the field. So just a little bit about yourself and this path that you chose. So the requirements are to have your bachelor's, and then there are 7 prerequisite courses you would need. So these courses can be done at any community college, but we also offer them ourselves. So you can take them through MCPHS as online classes. They would have to all be completed before you can start the program. But you are able to apply without having all of them completed. If you have 4 of the prereqs completed, you can apply and be accepted. And then you would have the remaining time up until the program start date to complete the remaining prerequisites that you need. So for the prereqs, you would need anatomy physiology 1 and 2. They would have to include a lab. Microbiology also with lab. You would have to complete general chemistry 1. Then you have the option of Chem 2 or nutrition. And most people choose nutrition. Um, we don't blame you for that. You then have to do a statistics course, and the last requirement is human growth and development or lifespan development. So these would expire at 10 years, though. So if they're older than 10 years, we wouldn't be able to accept them. So we would suggest that you look into either our courses, a local community college. We also do accept from Portage Learning, which is another online platform. So when you do apply, you would get access to the applicant portal. So this portal is where you can stay up to date on your application process and upload what you need. So it's good to see what you are. If you are missing anything, it would be noted here. And it's a good place to just keep track of all your documents and be able to upload them and just make sure that you're on track in completing everything you need to complete. So we do offer housing at our Worcester and Boston campuses. So the housing come in various options. So we have studio suites and condos. We also have apartments that would be available to you. The campus does come with a 24-hour fitness center, as well as cafes and student lounges for you. Escorts from public safety team are available after dark. We do our best to make sure that the housing is affordable. So we do monitor the local market and we place our rates competitively. Financial aid recipients may utilize part of their aid towards the cost of rent. Non-recipients can take advantage of an interest-free payment plan. So the benefit of our housing is that it's fully furnished, and it is convenient to some that the rent is charged once a semester. So at the Worcester campus, we do have parking options available, so you can apply for parking at our Worcester campus. So financial aid is available for those who qualify. We do our best to try to make this program affordable. Currently, for our fall semester, we are doing an automatic merit scholarship of $32,000. So if you are accepted into the nursing program for our fall start, you would automatically receive that. And for your remaining balance, we would then set you up to meet with one of our financial services counselors, and they can go over with you what you can apply for and what your options are to cover the balance. We do suggest filling out the FAFSA, and that would potentially give you access to federal aid. And that would be covered during your affordability appointment, and that's what we call your meeting with our financial services counselor. So some FAFSA deadlines to keep in mind for the fall start is March 15th, and for spring start, it is November 1st. And just so you know, spring is a January start. So we have the 2 starts a year. We have the fall, which is September, and January, which is spring, our spring start. So I do want to invite all of you to reach out if you do have any questions. Again, I do oversee the Worcester and Manchester campus, so feel free to reach out. My contact information is here. And Christine will be your contact at the Boston campus. And we do review the application, so we're someone that you can keep in contact with throughout the application process. And yeah, we're definitely happy to help. So we do want to open it up to questions. Um, First, a common question is the schedule. So this is a full-time program. So we suggest that you only work part-time hours because this is a very intense program. So your class schedule is typically 3 days a week, and the class times can average around 8:30 to 3:30 is what you can kind of bank on, and then you would have 1 to 2 days of clinicals. Again, the clinicals are 8-hour shift. They can be second shift. They can be on the weekends. You can request when you would what shifts work best for you, and again, we do our best to accommodate that, but we just can't guarantee when your clinicals will be. Right. Any more questions, feel free. Edie, could you talk a little bit about clinicals? Just explain a little bit what the student experience is like.
Sure, Christian, I'd love to. So, our clinicals start from your very first semester, and typically those clinicals are just kind of getting your feet wet, and they're dealing with the adult population, so more of your medical surgical population. And typically, those clinicals are ranging from 8 hours, 9 hours, 10 hours, or 12 hours. It really just depends kind of what semester you're in. So, our summer semester tends to be a little bit shorter, a 12-week semester compared to, we'll say, our fall semester, that's 15 weeks. And so, that first semester, you're in lab for a large portion, but you do attend clinical, which is unique to a lot of programs. Typically, you don't start until your second year in clinical in traditional programs. And then your next semester is your medical surgical semester. And so you are again in clinical in the adult inpatient acute care setting. These settings include the ICU, it includes telemetry, meaning cardiac floors. And so it's a bit of a higher level. You're taking care of much sicker patients, ones that require a lot more supervision and medication. And then your third semester is your pediatrics, your maternity, and your psych semester. So pediatrics and maternity is one course, although you do get to do both clinicals. And then your psych clinicals are also separate in that same semester. So, like Christian had mentioned, typically it's 1 to 2 days a week. So, in your third semester, you typically go to clinical 2 days a week. And we see a lot of births in maternity. You're able to do a lot of newborn care. You get to really work with a lot of different interdisciplinary team members like lactation consultants, different OBs. In pediatrics, we, like I mentioned, go to children's hospitals in New Hampshire and Massachusetts, where we're really able to go not just to pediatric floors, but pediatric ICUs or PICUs, which is a really great opportunity to see really sick kiddos. So, kiddos who in the summertime might have really bad asthma that we're taking care of, they might have a diabetes admission, which is called DKA, so diabetic ketoacidosis. So, those kiddos take a lot of care. You also get to experience different team members like child life specialists who are there specifically to help kids acclimate to the hospital. And then your psychiatric clinicals are typically inpatient psychiatric facilities. And those are typically 12-hour clinicals. So you do 4 12-hour clinicals to meet our hourly requirements. And then your last and final semester is really probably the most fun semester for students. Although I'm biased, I certainly think PD and maternity is the best. But your final semester is where you do your community and where you do your last kind of advanced med surg rotation. So many of your advanced med surg rotations are one-on-one preceptorships. We're very lucky that we get to work with a lot of hospitals that offer our students that one-on-one opportunity. So that means you're with a nurse for the full 15 weeks and you really get to become fully ingrained in what it feels like to really be independent. So taking on multiple patients, taking care of patients in the ICU, in the emergency department, in lots of different care settings. And so students really find that this is helpful for them because not many post-bac or accelerated programs allow a preceptorship. And this really helps, show you what your next step would really look like. All of the semesters vary in the amount of clinical hours that you're required. Typically, it's around 130 as an average. And so, depending on your schedule, we really try to have like the start and the end of the semester free for you to study and get used to what you're learning before kind of throwing you into clinical.
Awesome. Thank you, Edie. So you did kind of cover one of the questions. We did have some questions coming in, some very good questions. So as far as when clinical starts, so they do start in your first semester, but towards the end of your first semester, so not right away. So you do get some practice in our labs before you go off to clinical. So first semester, but not right away, towards the end of the first semester. And as far as clinicals, we had another question about placement of clinicals. So yes, you don't have to find your own clinical placement. We do place you at your clinicals. So that's something we will take care of for you. So the health requirements and background check requirements for clinical. Edie, could you talk a little bit about that?
Sure. So most of the clinicals have the same requirement. So typically, once you start in the first semester, we're really just kind of keeping track of your vaccinations. You do a background check as well for certain facilities. And then during your psychiatric rotation, you have to do drug testing for most of the psychiatric facilities. And our clinical coordinators who run the clinical team at each of the campuses, they help you keep track of anything that might be due. So say like your flu shot. So they're really great at keeping track of what you need for clinical and communicating that to you. And there, of course, are exceptions for certain students. If you need a medical exception, those are things that our clinical team will work with you on as well.
Thank you. So another question we have is the application deadlines and start dates. So yeah, so we have 2 starts per year. We have the fall start, which is September. We stop accepting applications August 1st for our fall start. But we do suggest applying as soon as possible, just because these classes can get waitlisted. For our spring start, classes will start in January for our spring start. And there we stop accepting applications December 1st. And the requirements general or different for mental health nurse practitioner? So the requirements are different for mental health nurse practitioner. So that is a master's level. So for the master's in mental health, that does require your BSN. So this BSN that we are discussing would start your path towards nurse practitioner. So that's where the differences are, because this requires a bachelor's, whereas the nurse practitioner requires you to have your bachelor's but also be a licensed registered nurse.
And just to follow up on that, you can see the requirements for the Masters of Psychiatric Mental Health Nurse Practitioner on our website. So I can put it in the chat as well. I can type an answer to you, but you'd want to look at that because there are specific requirements for that program.
All right. Thank you for those questions. Keep them coming. If you have any more questions, we are here, happy to help answer. But again, for as regarding the applications, directly on our website, mcphs.edu, and you'd look for the transfer application. Be sure to either include your transcripts or make sure that they are in the process of being sent, and we have an email inbox, so feel free to request that, and we are happy to share that with you. So for Worcester, it would just be worcester.admissions@mcphs.edu, and if you're interested in Boston, it would be admissions.boston@mcphs.edu.
It's actually just admissions@mcphs.edu.
Oh, okay. Thank you. Sorry about that.
Yeah, that's okay. A question just came in. Does the transfer count towards the master's? No. So the master's program, if you're applying to that, you have to do the graduate application. It is a free application on our website. So if you go on the website, you can just click. When you go to apply, you'll choose transfer or graduate. So that's the biggest thing. One question we commonly get is, I know we talked about the differences between the programs, but if you're between which campus you want to pursue this program at, since it's at all three campuses, feel free to reach out. Christian and I can help kind of walk you through maybe what we hear from other students, but you're going to get the same type of experiences, the same type of teaching, and the same hands-on experiences. So you can't go wrong on any of our three campuses. So just keep that in mind.
All right. Any more questions? Well, it looks like that might be it as far as the questions. So I do want to thank all of you for attending tonight. We do hope to see and hear from you again. So be on the lookout for any on-campus events. We will be sending invites for that. But feel free to send us an email if you have any questions. And if you want to get your application started, you're more than welcome to as well. So I want to wish you all a great rest of your evening, and we hope to hear from you soon.
Hi,
Bye.
everyone. Thank you.
Thank you, everyone.